All right, hi everyone, Dr. Bell here again, and today I'm just going to take a few short minutes. This isn't going to be a very long post today, but what I want to talk about today is a couple things that happened this week. I just wanted to go over some things and some thoughts that I had about what to do if you're in pain and you need some help. So this week we had a couple of patients contact us, and their doctor had canceled their elective surgery, and they were looking for somebody to help us because they saw some of our stuff on Facebook and had seen some stuff when they were scrolling through social media. So both patients were kind of left in a weird position, sort of helpless, because the surgeries were canceled because they were elective. And of course, the reason they're doing that is to keep patients out of the hospital so they can help patients that have coronavirus or need treatment in that way. So the problem was they really didn't have any idea when they were going to be able to schedule their elective surgeries. And so it brought up a good point, because what do you do if you're in help and you need some pain? And that's where we actually might be able to help you. We're an integrative medical clinic. We have several options that we can help you with. We have a great medical team, but we also have a great chiropractic team and a great therapy team as well. So we don't typically see patients who are sick, and we're not a family practice, and so that's really not where we're focusing our energies. What we're looking to help patients with are patients who might have a surgery that could possibly avoid a surgery with one of our alternative procedures, and it might actually be a real suitable alternative for you as well. So it could be a blessing in disguise. So we have some options. We have very simple things like chiropractic care, which is a great thing to use for aches and pains and sciatica, back pain, shoulder pain, knee pain, those types of things when they're very simple. And it's also a good benefit with chiropractic that if you have your spine aligned, that you also can see your body's immune system be able to be boosted. And so that's actually something that chiropractors are taught from day one in school, is that the power that made the body can heal the body. And so if your spine and your nerves are working properly, then that gives your body the best chance to have an immunity, or to build its immunity. Our medical team is highly skilled in regenerative medicine. You may have heard of stem cells and how stem cells can fix and heal the body. And that's what regenerative medicine does, is it helps your body repair itself. And we have several programs that may be a benefit to you. And it may even help you, or maybe necessary, that you might not even have to have the surgery at all, because that happens very, very frequently. We get patients that come to us that want to avoid surgery or are looking for an alternative. So the main things we're looking at there is going to be arthritis in your knees, in your shoulders, your neck, or your back, degenerated discs, herniated discs, sciatica, facet disease, numbness, tingling, burning, neuropathies. Those are all things that have a great track record with regenerative medicine. And so that was really one of the things that had happened with one of the patients that called us. He wasn't able to have his knee surgery. And of course, it's rainy out, it's cold outside, and we can't go outside. He's not moving. So his pain was getting really bad, and he wasn't able to walk like he wanted to. And so he was just wondering if we could help him. And of course, we'll be able to offer him a really great service with a really successful treatment program that we have. So the other thing as well that is good to remember is, if you're not working right now, or you're not able to exercise because most of the gyms are closed, it is a good idea with a lot of our programs that we ask that you don't do any exercise or any type of vigorous activity for about 2 to 3 weeks. And so if this is a good time where you have downtime right now, it's a very, very good idea then to maybe consider undergoing one of our programs, because that way you don't have to be tempted, or there's things that you may not have to do at work that could cause a flare-up or slow your progress. And so it's also something to think about too, if you've been thinking about looking into regenerative medicine or chiropractic or spinal decompression, one of the programs that we have. But I know this is a tough week out there. I know that we've been hearing that we're in the worst of it, and this is going to be the toughest week so far because of all of the graphs and curves are saying that we're seeing a rapid increase in cases and things with the coronavirus. But I want you to know that we're here for you. If you don't want to come to the office, because I know a lot of people have been told not even to go to the grocery store this week, we can do Zoom calls, we can do telephone consults. And at least in our local area here in Temecula, as well as in Hemet, If you've had your films taken at one of the local facilities, we have an online portal that we can actually access your records, so we can review your x-rays, we can review your MRIs, and we can do a screen share through Zoom, and we can actually go through and show you on your x-rays where your problems are and things like that. So we don't have to have an in-person visit. But if you do want to come into your office, we are open. We are an essential business, and so we sanitize our treatment rooms after every patient. And like I said, we're also not a family practice, and so our typical patients are not coming in sick. We've also educated our patients to know that if they are sick, they do have any kind of symptoms, whether it's coronavirus related or if it's just a cold, flu, or something like that, and not feeling well, just to stay home. And so you can rest assured that we're doing our best to minimize the risk to patients. We're all wearing masks in the office, and our patients are all wearing masks and following the guidelines. And so we don't want our staff to get sick. We also don't want our patients to get sick. But again, the risk, I feel, is very, very low in an office like ours. And so we'll be happy to do a 15-minute consultation with you. We have same-day appointments available, so you can call Stephanie. She's available, and she's our new patient coordinator, so she'll take all of your information and get you routed to the right office, and she answers calls for both of our offices. And so if you would like to call her and schedule some time with us, you can reach her at 951-225-4419. So that's it for today. I know it was very, very short. I just wanted to pop on and just go over a few quick things that we can do that are more in our wheelhouse in terms of pain and inflammation and arthritis and things like that. So I want everybody to take care out there, stay strong, stay healthy, and we'll see you next time. Thank you.